Well, this morning there are now 2 cases of measles in Colorado this year.
This second case is a 1-year-old in Denver who recently traveled. 9 News health expert Dr. Payal Kohli joins us now to talk about what can be done to prevent the spread.
Good morning, Dr. Kohli.
Good morning.
All right, we understand that this is something that a lot of people, of course, are scared of. We asked you the last time if we should be worried about a spread up this way when we got that first case in Pueblo. I want to ask, why are young children high risk from measles complications?
You know, it's not unexpected that it's spreading like this, right? Now that it's here, we expect it to grow. But these young children under the age of 12 months, they're not vaccinated yet. So they're extremely high risk, and we can't actually vaccinate them because their immune system is too naive. So if you think about them contracting measles, the way that the immune system responds is not strong enough to fight off the infection. So the infection can very easily lead to severe complications like pneumonia, swelling of the brain or encephalitis, permanent hearing loss due to ear infections, and they can easily end up in the hospital.
So with that, when should children be vaccinated then?
So usually we say at 12 months, and then the second dose is between 4 and 6 years. And the reason for that is before 12 months, their immune system is a little bit too naive to actually handle the vaccine, which is a live vaccine. So it's a live version of the virus that's injected, and so it could overwhelm the immune system. They also have antibodies from mom. So if mom had been vaccinated, she usually passes the antibodies through the placenta, which can actually decrease the efficacy of the vaccine. So it makes the vaccine work less well. Now, once in a rare while, we'll vaccinate a 6-month-old who might be traveling. So this might have been an example where you would give a sort of outside-of-the-box vaccine at 6 months and still give one at 12 months.
Well, I have a lot of friends who have kids who are under that 12-month period right there, and they're kind of freaking out about this, understandably. What do you recommend that parents do if they do have a child that young?
I mean, I would freak out too, because right now it's all hands on deck, and these children are basically unprotected from the most contagious infection that exists in medicine, which is measles. So I would say a couple of things. If you're pregnant or expecting, you make sure that that you've been vaccinated. You can't get the vaccine while you're pregnant, but if you're planning to get pregnant, because then you can pass the antibodies to the baby. But the concept of herd immunity is what really kicks in here. So if you live with someone who's under the age of 12 months, or you might come into contact with them, the fact that measles is here in Denver, you getting vaccinated will protect that child because you basically stop the spread of the infection by being vaccinated. So it's really up to us to protect the kids, the pregnant women, and the immunocompromised patients.
Dr. Kohli, I think it's important to talk about the impact here. You know, people might hear that this is here in Denver now and want to know, well, how does this affect me? What do I need to do? So what advice would you give those people?
I would say a couple of things. Look back into your vaccination records and make sure that you've been vaccinated, because we're seeing now, even though the rate of vaccination in Denver County is pretty good, there's some spotty areas, and some people may not have gotten that MMR vaccine. So make sure you've gotten those 2 doses, because that's a 97% protection. If you've come into contact with anyone who potentially has measles or may be ruling out for measles, make sure to call the CDPHE and let them know, because it's really important to do contact tracing as well.
And let's emphasize right here, kind of as you're saying that, there was a whole generation, like a time period, that they were not giving the measles vaccine, right? That was kind of in the 60s if you were born in that time period.
So before 1957, you've likely had measles. Between 1957 and 1968, you got an older version of that MMR vaccine. So if you're born between those years, it may be worth checking your titers. And if you were born in another country where you're not sure whether you got it or not, it's an easy blood test to check and see. I actually did it on my mom because she was born before.
My mom too.
Yes, and my brother had gotten measles when he was a little baby, 7 months old. And so he has this natural immunity now, of course. But it's really important to make sure that if you were born in that period or afterwards, or in another country, or if you have problems with your immune system, that you check your titers, because your doctor may recommend a booster. In fact, we are for some people now that it's here in Denver.
Okay, Dr. Kohli, a lot to think about there. Thank you very much. We appreciate it. And a reminder, you can find all of Dr. Kohli's appearances and segments on 9news.com/Dr. Kohli. Let's get check your forecast now with Chris.